Domestic violence refers to abuse or violence that takes place between adults who are partners or who are close relations. Although violence conjures up thoughts of physicality, the definition of domestic violence also encompasses verbal abuse, intimidation, sexual assault, and even rape. Sadly, domestic violence is a common phenomenon affecting 1 in 4 women, with 2 women a week being killed by current or former partners. But, however, it is important to acknowledge that over 40% of domestic violence victims are male, and they may not be forthcoming due to shame or embarrassment. So, domestic violence has been defined by the Department of Health and to refer to any incident of threatening behavior, violence, or abuse, psychological, physical, sexual, financial, or emotional, between adults who are or have been intimate partners of family members, regardless of gender or sexuality. So, I'll taking history approach the topic sensitivity. So, approach sensitively in a non-threatening, non-judgmental manner. It can be quite difficult to broach a subject initially. So, begin by making your first few questions designed to put a patient at ease and avoid focusing on injuries without addressing the underlying cause. So, start from open questions like, you look upset, is everything alright at home? Is your partner taking care of you? Do you get on well with your partner? And then confidentiality, reaffirm that and emphasize that everything discussed is confidential, and pick up any cues such as multiple minor injuries, fractures, multiple accident emergency, and attendances. And I noticed that you have a number of bruises, cuts, burns. Is everything alright? And then ask about leading questions. Ask more direct and leading questions, inquiring about possible injuries. How does your partner treat you? Are you having any problem? And do you ever feel frightened by your partner? Do you feel safe at home? Has your partner ever hurt you in any way? And then ask about partner. Has your partner ever physically hurt or threatened you? Has your partner ever broken or destroyed things that were personal to you? Has your partner ever prevented you from doing things that you wanted to do, such as leaving the house or going to see friends? Does your partner have any criminal connections or convictions? And listen. Allow the patient time and space to express their story, and be empathic and say, thank you for telling me. I know it must have been difficult to do so, and it's not your fault. You are not to blame, blah blah. And ask about the frequency. Inquire whether the violence has increased in frequency and severity, and ask about, is the abuser intoxicated? And ask, have you ever been humiliated emotionally and verbally abused, including put downs, or afraid of raped, or kicked, physically assaulted by your partner? And then ask about red flags, about self-harm, like, have you ever felt so low that you wanted to end up all? Have you ever tried to take your life? And ask about children. Inquire if there are any children at home, and establish if they are at risk. And has your partner ever threatened or abused your children? And ask about the rape. Ask if their partner has ever sexually abused or raped them. And have your partner ever forced themselves on you even when you did not want to have sexual intercourse? And then subtle clues to domestic violence, like is still considered a taboo subject, with women experiencing around 35 episodes of domestic violence. and before seeking help. And so patients delay presentation for a number of reasons, like the most common of which include feeling shame or embarrassment, worry about referrals from partners, or fear that their children will be taken away. And patients may present with subtle signs and symptoms that may be a clue that domestic violence is taking place. And it's important to be aware of these, such as delayed presentation, multiple injuries, abdominal, face and hand fractures, unexplained bruising, burns, and injuries at different stages of healing, history of loss of consciousness, and miscarriages. And ask about past history of ops, and have you had any terminations or miscarriages, and then about the mental health, have you suffered with low mood or anxiety, and ask about the social history, who lives with you at home, and about support and networks, have you spoken to anyone about this, and to your friends or to police, and ask about the occupation, are you currently working or studying at the moment, and about alcohol, do you drink alcohol, how much do you drink and how often, and about the drugs, have you ever used illegal drugs. So there are consequences for victims of domestic violence, that victims of domestic violence are 15 times more likely to abuse alcohol, and 9 times more likely to abuse drugs, and 3 times more likely to be diagnosed as depressed or psychotic, and 5 times more likely to attempt suicide. So approach wisely. And there are CSA tips that domestic violence is extremely common and is not solely committed by men to women. It is important to broach the subject in an empathic way, as many partners may find it difficult to talk about the subject for fear of retribution. So be empathic. And the patient records may give you an indication that they are undergoing domestic violence due to unexplained falls or injuries in an otherwise fit and well patient. And so, when opening the subject, remember that the patient is an adult and cannot be forced into making a disclosure or taking further action. Always ask whether there are children at home, and consider making a referral to the local child protection team if you are concerned that there are risk of abuse or neglect. And then a management plan about the illegal. Stress to the patient that domestic violence is illegal, unacceptable, and should not be tolerated. Offer to contact the police if the patient consents, and respect autonomy if they do not wish to do so. And children's safety. Ask about if there are children involved. Seek advice from your child protection lead. The child may require transfer to safe location if at risk, and refer to a multi-agency risk assessment conference. And then tell about the visa. Reassure the patient that the government supports victims of some domestic violence in their immigration application, so they need not to worry about their visa. And there is government immigration policy towards domestic violence. And domestic violence victims can apply for indefinite leave to remain in their own right if they have been victims of domestic violence during the first 2 years of that relationship. And then tell them about the safety plan, escape route. Their plan and escape route is stairs, doors, or windows if you need to leave quickly, and escape bag, a bag, an emergency bag that contain money, phone, keys, important documents, passports, and can leave this at a friend's house. And tell them about numbers. Have a range of emergency numbers, like of your friends, 999 or refuge. And about neighbors, advise neighbors to contact police if they hear shouting or suspicious noises. And tell them about safe house. Have a safe house, a friend, family, or refuge that you can reside in an emergency. And tell them about services. Contact National Domestic Violence Helpline, local services, women aid groups and refuge, and relate local police traumatic violence safety unit and housing associations. And then follow up, offer open same-day emergency appointments, take into account that a patient may not be able to attend a routine due to circumstances. and add an alert to notes not to inform family, and highlighting that a patient is at risk of domestic violence. And there are principles of approaching domestic violence like support, emphasize and listen to the patient, appreciating and their capacity to act while respecting their autonomy. Whatever you decide, we are here to support you, and document any injuries and take photographs if indicated. And if there are children involved, and then a referral to the child protection may be necessary, and inform them of the referral need and to breach of confidentiality before doing so. And there are explanations about domestic violence. I'm sorry that this has happened, and I would like to reassure you that we are here to help you through this period in any way we can. And the first thing we should know is that it is not your fault what has happened to you, and it is unacceptable and it's criminal offense, and you do not have to live like this if you do not want to. And there are a number of different options, and whatever you choose, we are here to support you. Okay, so it was all about the domestic violence, how to approach this case in Mrcgp-Osce.